ADHD is a neurodevelopmental disorder, which means if we try to understand it in a very simple language, the brain is wired differently for some people. So it is usually by childhood that the brain is wired differently, and that's why you will have some symptoms. The common symptoms are inattention, hyperactivity, distractibility, and impulsivity. So this is what ADHD is. Broadly, there are two types. As I said, I told you the symptom clusters, no? So according to that, one is the inattentive type, in which majorly the attention is impaired. So you will see that the kid is not able to focus, but they're not that active. So the major part is their inattention. So they're not able to focus. They'll be daydreaming more. And the second type is in which hyperactivity is more. So you'll notice that the kid is again too hyper. They are constantly running, talking, disruptive, not following the rules. So these are the two types. One is the inattentive type, and the other one is the hyperactive type. And some people can have both. So that is called as the combined type. So when we talk about causes of a psychiatric disorder, including ADHD, they are multifactorial. It's not just one specific cause that causes ADHD. So of course, there are genetic underpinnings. That is, if you have ADHD in the family, you have more chance that you can have ADHD because of the genes that you have. Then it is the environment. For example, exposure to some toxins has been associated with development of ADHD in the kids. So prenatal exposure of toxins. And then it's the environment, for example, the parental interaction that can actually manifest more symptoms. So it is a multifactorial reason or multifactorial causation for ADHD. So let's say a patient comes to me, a kid is brought to me by the parents or referred to me by the school. Then first I'll do a clinical diagnosis, which means I'll take a proper history and I'll examine my client in the clinic. And then if I feel that yes, clinically that person seems to be having symptoms of ADHD, then I'll send that person for psychometric testing. That is psychologically, there are scales that we use to see how much the symptoms are affecting that person. These two ways are basically used to diagnose somebody with ADHD, clinical and then psychometric testing. For ADHD diagnosis, immediately after the child is born, we don't see those symptoms. We usually, for any psychiatric diagnosis, especially in childhood, we like to observe the child for a longer period of time. So usually we see that those symptoms will start manifesting by the time the social or emotional development of a child is to a level that we can see that this child is lagging behind. For example, they may go to the school or they're interacting with their peers. That's when the symptoms will start manifesting. So yes, they have ADHD, but the symptoms will manifest once they start interacting with the environment in that capacity. So from the school, maybe you'll start getting complaints that the child is not focusing in the class, they are daydreaming, or they're very hyperactive. That's when you start understanding that, okay, the child may have ADHD. So no, they don't, the symptoms will not manifest immediately after birth. But if you observe the child as they are growing, you will be able to see the symptoms. The common signs that will be there are that you'll see that the kid is not able to focus. They have difficulty in concentrating for a longer duration of time. Now, this is relative. That is, it means that it is not normal as per most of the kids of that age or according to the expectations. So you'll see that the kid is not able to focus. They are not able to concentrate. If they have the inattentive symptoms more. And then you'll see that they are daydreaming. Then you can see that they're more hyperactive. So it will feel like the kid is driven by a motor. They are constantly running, and in the class also they are not able to sit. Then you'll see that the kid is impulsive. So they may cut you in between. They will be very talkative. They will not let you complete your sentence. So usually these kids will appear to be disruptive or defiant. So if you are noticing such symptoms, it's better to get an evaluation done for the kid for ADHD. If you see the symptoms, now a kid who has ADHD will obviously, if he's not supported or not helped with the right kind of treatment, will face difficulties academically. So then the kid starts lagging behind. Then these kids don't have adequate social skills. They need to be helped with that. So they'll have difficulty forming relationship with their peers. And that will obviously impair the way they are adjusting to the schools. So their school performance will go down. Now, as we grow up, the symptoms of ADHD do remain. So that will start affecting your close relationships because you'll not be able to form close relationships in a healthy way. You may take impulsive decisions as an adult, for example, impulsive financial decisions or impulsive decisions in a relationship, and the relationships will not work. And at the work also, your productivity will be impaired. So a lot of people who have ADHD as adults, then their productivity starts falling. They're not able to organize their schedules well or deliver as per their capability. So it impacts every sphere of your life. These are the complications of having ADHD. Also, ADHD is comorbid with a lot of other disorders. So somebody with ADHD can have, there is a high probability of having learning disability also. And then it goes hand in hand with anxiety disorder, depression, substance abuse later on. So all these complications can be there if somebody has ADHD. ADHD is manageable. So what do we mean by that is that let's say I have ADHD, I can't change the brain back, the kind of normal brain, like somebody has neurodevelopmentally, the brains are different. So you can't make the brain go back. But yes, you can manage the symptoms, which means your functioning can be improved to a very large extent if you are under treatment. So yes, it is treatable. To a large extent, your symptoms get managed and your functioning gets much, much, much better. Treatment options available would be number first, medications that are given by the psychiatrist. The medications are of the group stimulants, so they are not prescribed usually. They have to be taken under the supervision of a psychiatrist only, but they are very, very helpful. So one is that medications, and then the second part of the treatment is therapy. So behavioral treatments go hand in hand when we are treating somebody with ADHD, in which we help the kids learn coping skills, we help the kid learn social skills, then we do parent training, and then we do cognitive behavioral therapies also for helping the kid learn emotional regulation skills. So both the things are combined, and that's how we help an individual learn how to cope up with the symptoms of ADHD and improve their functioning. First and foremost would be what we are doing right now, talk about it. Right? When we talk about something, that's how parents learn that it's not that the kid is a bad kid. They are facing some issues due to which they are not able to perform as per their capabilities. So first would be for all the parents to get aware of the symptoms of ADHD. And then if you can see that there are some symptoms, then get them evaluated by a psychiatrist and then start the treatment. So, as a parent, you will be trained in the treatment itself. For behavioral modifications can be done for the kids that will help them deal with these issues in a better way. So, we train the parents. Parents are a part of the treatment team, and we train them how to basically interact with the kid so that the negative behaviors are not reinforced. So that's how the parents can participate in the treatment. And of course, unconditional love for the kid. They have to understand that the kid's brain is wired differently. And we work with the parents so that we can recalibrate their expectations. And once they start understanding the disorder, they can change the lifestyle according to it. So a lot of interventions, let's say food, what food to eat, like sleep. The kid needs to have a proper sleep, their playtime, their exercises, doing mindfulness based activities. All these things we can help the parents incorporate in the child's schedule. So parents can play a big role in the treatment. As I specified, I'll be telling you those briefly. First is sleep. Sleep would be very, very important for some kid who's having ADHD. So we have to make sure that the sleep is proper. Then the food that they eat, there are certain trigger foods that actually increase the symptoms of ADHD, for example, high sugar, or for example, artificial sweeteners. So you have to identify those things and you have to make sure that the child's diet is healthy. Certain supplements like omega 3 fatty acids have been shown to help in ADHD. So those kind of interventions, and then mainly the interaction that the parents is having with the kid. So that has to get better depending upon the behavioral modification that we suggest to the parents so that their negative behaviors are not reinforced. And then attention training. So these are the lifestyle changes that the parents can do in order to help somebody with ADHD. And there are many more. So we go about it in a step-by-step way so that the kid finds it easier to adjust to those symptoms.